Okay, so I'm here with Dr. Perez and Dr. Zinn, and we're talking about one of the biggest issues that dentists are faced with as we're trying to present treatment to patients. And one of the biggest things is we're focusing on is how to get people to prioritize their oral health, their dental care. That we present treatment to patients and we explain, and well, they seem to get it, but then they don't get it. So why don't you shine a little light on that for us?
I think most people don't understand the importance of their overall dental health, the importance of just being able to chew, being able to have healthy teeth, having a confident smile. A lot of patients really don't understand how important it is to take care of their teeth because overall, a lot of patients end up regretting later on that they didn't take care of their teeth when they were younger.
How many times have you heard patients say that famous line, oh, if I knew then what I know now, I wish I would have taken better care of my teeth.
Too many times.
It's
Too
almost,
many
it's
times.
if it's not daily, it's weekly,
Yep.
for sure. People regret that. And if you could turn back the clock,
Mm-hmm.
I see patients sometimes I wish, gosh, I wish I saw this patient 20 years ago.
Mm-hmm.
So
Yeah.
it's
Happens
what
all
we're
the time.
faced with. So
Mhm.
is there any words that you would say to people to get them to say, hey, like you want to shake them, how important this is to their oral health is taking care of their teeth?
I think the most important thing is, take care of it now when it's easy to take care of it. And it's a lot simpler because, as you let it get worse or you don't take care of it, it gets more complicated. You can have pain, you can have discomfort. We just want to make sure we stay healthy, keep you just on a regular.
Problems don't go away,
No,
they get worse.
they do get worse.
Great.
Hmm.
Okay. So, Dr. Zinn, what do you think as far as the connection between the mouth and the overall body, people's overall health, and the focus that they need to place on their health?
Well, if we think about it, the mouth is the entry port to the rest of the body. So if we're dealing with a dirty mouth or something that has been neglected over time, the next place that it goes is down the pipe. And down the pipe means to your stomach, to your intestines, to your liver. And what we're really talking about is bacteria. And what bacteria does is causes inflammation. Inflammation in your mouth is unacceptable. It causes loose teeth. It causes for teeth to be extracted way sooner than they probably should. But if you can imagine that same bacteria spreading to the rest of your body, it can cause for serious, serious concerns, not just with your mouth, but with other body parts.
Yeah, I say to people all the time, because sometimes you have to refocus people, that people have to understand this is the one part of your body that you can truly control the health of. You can't, God forbid, prevent cancer or diabetes or anything like that, but you can make a choice today that I'm going to have a healthy mouth. And this is something I can decide that I'm going to do. And that's what we have to get across to our patients, that you take care of this, it makes so many other things easier down the road. That if you're dealing with oral problems when you get older and then other medical issues, that's just a snowball effect.
One thing compiles onto the next, and it becomes even more difficult to manage all those things later in time.
Right. And isn't you're not surprised. We're not surprised when we look in somebody's mouth and they have great oral health and the rest of their body's
Yeah, they don't
great
take any
too.
medications, but those patients that have gum disease, have issues, are probably taking medications for diabetes, for high blood pressure, for other things that might have been managed earlier in time, but are now out of control and need to be managed by other providers, other medical professionals, other situations that none of us want to get involved in.
And we know the link between perio disease and the rest of the oral body complications. Remind our patients, what are some of those things that perio has been linked to?
Perio has been linked specifically to heart conditions, high blood pressure, stroke, and even for us men, erectile dysfunction. So things that are really scary, especially to us guys, that we do take very seriously, all start with our mouth.
And on the other hand, women, early term birth has been linked to perio disease. So it affects the whole body. And that's what we want to get across to our patients, how they need to prioritize their oral health so they can keep the rest of their body healthy. So that's our message for today. Thanks, guys. And we'll see you next time. We're going to talk something else as far as prioritizing your oral health.
See you
Thank you,
next
Dr.
time.
Mars.
Thank you. Thank you.